Improve your kidney's ability to detox like never before with these 14 kidney-boosting foods. The blood is being filtered from all the contaminants through the kidneys, and since the blood is of great essence for the body, the kidneys are vital organs that need to function properly. These organs eliminate the excess water and cleanse the blood of toxins. Kidneys are important for the electrolyte balance, for the control of the blood pressure, and for the red blood cell production. People are more frequently experiencing kidney issues, and the seriousness of this health issue rises day by day. Symptoms and signs of kidney disease: loss of appetite, changes in urination, nausea, vomiting, reduced mental sharpness, fatigue and weakness, sleeping disturbances, muscle twitches and cramps. The importance of kidneys: the kidneys produce a hormone that is accountable for the production of red blood cells. The other hormones produced by the kidneys assist in the regulation of the blood pressure and control calcium metabolism. These vital organs have the most important role of the body, and that is the removal of the waste products from the body. Therefore, we need to take good care of them, and we can achieve that if we introduce the following beneficial foods. 14 beneficial foods for your kidneys. Apples. This fruit is great for the health of the kidneys, and it is extremely beneficial if consumed in the initial stages of the kidney disease. As per performed study at the Institute of Child Health, University College London, food sources of pectin in fruits like apples and oranges substantially lower kidney damage over a period of time. Celery seeds. The function of the kidneys needs to be normal, as if there are misbalance issues like fluid retention, waste accumulation, electrolyte disorders, and acid-base imbalance of their function can occur. These disorders will influence the kidney's condition and enhance the progress of kidney disease, leading to kidney failure. The consumption of celery can help control kidney disease complications. Cranberries. Urinary tract infections, UTI, that are not treated and occur frequently can lead to infection in the kidneys. If the kidney infection becomes chronic, then this becomes a risk factor for chronic kidney disease. The cranberry juice makes the urine more acidic, thus preventing urinary tract infections. Dandelion. This plant is versatile in its uses, namely in the past its roots and leaves were used to treat liver issues. Dandelion was well known by the Native Americans, who boiled dandelion and drank its water to treat kidney disease, upset stomach, swelling, heartburn and skin concerns. Chinese medicine uses dandelion to treat appendicitis, stomach issues, and as well as breast problems like inflammation or lack of milk flow. Ginger. This root can be very beneficial if you suffer from chronic kidney disease, CKD, or if you are in an end-stage renal disease, ESRD, under chemotherapy or peritoneal dialysis. These patients need to follow restricted diet, and the use of ginger or garlic can be of great assistance to them, provided that it fits their recommended dietary plan. Grapes. Grapes contain a compound which may reverse kidney disease. Have in mind that diet high in fat can cause the occurrence of a kidney disease. The lipids can elevate oxidative stress, and the depleted copper levels in the kidneys can cause potentially lasting and debilitating effects. Gravel root. This root with interesting history is well known for the benefits in the treatment of urinary tract problems like urinary or kidney stones. Hydrangea root. The root of the plant known as hydrangeas is used in the preparation of the medicine, more specifically the root in the underground stem. This plant is used in the treatment of urinary tract problems, including infections of the prostate, bladder, and urethra, furthermore for the treatment of an enlarged prostate and kidney stones. Likewise, it can be used in the hay fever treatment. Lemons. The juice of this citrus fruit is a helpful treatment for kidney stones, lowering strokes and decreasing body temperature. The consumption of lemonade will refresh your body and help you stay calm and cool. Marshmallow root. Marshmallow contains diuretic properties that incite elevated urine flow, and this process will cleanse the kidneys and bladder, lowering the accumulation of toxins and minerals. Nettle. It is believed that the consumption of this tea will dissolve kidney stones and treat urinary infections and kidney inflammations. It can as well as prevent water retention and efficiently cleanse the blood, getting rid of the harmful toxins. However, this consumption is not an alternative for proper medical care. Parsley. Aside the use of cranberries, aloe vera juice, dandelion, apple cider vinegar, herbal tea, buku, and barberry, you can also use parsley juice for the treatment of numerous kidney diseases. Turmeric. Turmeric contains an active ingredient known as curcumin, which incorporates powerful anti-inflammatory properties. These properties are extremely beneficial when chronic kidney disease, CKD, is concerned, which is an inflammatory disease that can lead to end-stage renal disease, ESRD, resulting in dialysis and transplant. Yarrow. This plant is a roadside weed in many areas, but it can calm the nerves, lower liver and kidney infections and offer powerful antioxidant and anti-inflammatory effects. Recipe for kidney cleansing juice. Needed ingredients: 1 tablespoon of dried gravel root, Eupatorium purpurea. 1 tablespoon of dried marshmallow root, Althea officinale. 1 tablespoon of dried hydrangea root, Hydrangea arborescens. 1 quart of juice, apple, cranberry, grape, or melon. Method of preparation. For the preparation of this recipe you will need a mortar and pestle so that you nicely crush all the ingredients, turning them into powder. Once the ingredients are well crushed you will need to use 2½ ounces of the herbs and then mix them into the apple juice. Place the mixture on heat and bring it to boil, and then pour it into a cup. Drink this beverage several times a day for 3 consecutive days. Coffee is good for the kidneys? As coffee is one of the most popular drinks in the world, there has been many studies that look into its health effects. Studies have been conducted on just about everything, from how it impacts our immune system, to the risk of heart disease, and cancer risk. A new study is looking into coffee's effects on kidney disease. Studies have shown an association between the consumption of coffee and a possible protective effect on kidney function. In 2008, a study from Korea that involved 2,600 women showed that consumption of coffee was associated with a decreased risk of kidney disease, even in diabetic women. Bear in mind that population-based surveys are not enough to draw hard conclusions. Consequently, a meta-analysis published in 2016 attempted to answer this question, in which it showed no association between coffee consumption and increased risk of kidney disease in male patients. Actually, it noted the possibility of a reduced risk of kidney disease in women who drink coffee. Based on the aforementioned data, coffee appears to be harmless on male kidneys and beneficial to women's. Furthermore, the results of the above meta-analysis are similar to another study from the Pacific coast of Nicaragua, where a lower prevalence of chronic kidney disease in coffee-growing villages has been recorded. Speculation on why coffee might play this active role is still being studied, though it is believed that it is due to antioxidants present in coffee. Coffee's effect in people with genetic kidney disease. In the past, scientific studies indicated that caffeine could increase the risk of growth of kidney cysts in patients with autosomal dominant polycystic kidney disease, PKD. However, more current clinical studies found that coffee consumption was not noted to be a risk factor for PKD progression. Risk of kidney stones. Nevertheless, special situations where intake of coffee might need to be moderated still apply. Kidney stones are one such scenario. Oxalate stones in particular, one of the more common varieties of kidney stones, occurs due to regular coffee intake, with black tea being the other culprit. Risk of kidney cancer. Evidence regarding coffee risk and cancer is quite mixed. Some studies indicate a reduced risk of renal cell carcinoma with coffee consumption. But this only appears to be true for caffeinated coffee only. Decaffeinated coffee consumption seemingly increases the risk of clear renal cell carcinoma subtype, a particular kind of kidney cancer. Still, more studies need to be conducted to better understand this potential link. Indirect effects of coffee on kidney function. One of the biggest causes of kidney disease is high blood pressure, after diabetes. Evidence shows that drinking caffeinated coffee could cause a short-lasting increase in blood pressure, with the effects seemingly exaggerated in older patients and people who are not regular drinkers of coffee. An increase in blood pressure is also seen more frequently in people who already have a history of high blood pressure. Due to the link between coffee intake and elevated blood pressure, concern about coffee's ability to could cause damage to the kidneys is often raised. Still, there is evidence to the contrary. Data shows that as long as daily coffee consumption does not exceed 3 to 4 cups, with each 8-ounce cup containing 100 to 200 milligrams of caffeine, there is no increase in risk of kidney disease in healthy young subjects. Decaffeinated coffee and hypertension. Coffee has been found to increase the nervous system activity as well as blood pressure, independent of its caffeine content. So, the effect of increase in blood pressure is even seen with decaffeinated coffee, making it seem that there might be something other than caffeine in coffee, which could be contributing to blood pressure elevation.